Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today our guest, Connie Vatsa, is going to talk through a new program to support people in mental health crisis that could be more effective and more cost effective. Welcome, Connie. I'm so glad to meet you.
Thank you for having me.
So this has got a lot of sort of tentacles. But the beginning of it is the suicide crisis Lifeline, right?
Yes.
And who created that? How did that start?
So the National Suicide Prevention Lifeline has existed for some time with the number 1-800-273-TALK. What the federal government did is decided to strengthen that system and give it an easier number for people to remember, 988. So they strengthened that national system.
That's really much easier.
Yes.
And the point there is if someone is feeling suicidal or in a mental health crisis, they can call and talk to someone.
Yes, any type of behavioral health crisis.
So someone who is trained, any type of behavioral health crisis.
Yes.
Okay. And that was facilitated by the federal government, but it's not necessarily like a national, exactly the same thing. Local people had to put support in place for that as well.
Yes, the state had to build out some infrastructure for the 988, and specifically in Virginia, they built 5 regional crisis call centers to coordinate with the 988 providers.
That is really cool. So how does it work? How do people on the phone, how can they intervene in a behavioral health crisis?
So the 988 call takers are trained to triage behavioral health crises into 4 different levels, 1 being the lowest level, 4 being the highest level. The level 1s are determined to be appropriate for phone support, so the 988 call takers will provide that phone support, counseling, direction, guidance on resources, that sort of thing.
So that might mean just like a level 1 might mean I'm really depressed, I'm having trouble getting excited about my life, I'm not planning anything immediate, but I need help.
Correct.
Okay.
Yes. So a level 2 is where an individual might start to have some thoughts of suicide. So the 988 call takers are going to coordinate with that regional crisis call center hub to dispatch a regional mobile crisis team for an in-person behavioral health response where the person is at.
Wow, that's amazingly different. I mean, that's a huge step forward. Like that could keep people out of the emergency room, that could intervene more quickly. Even though someone might not be based in Hampton, they're coming from a regional center, you know, you're not being seen by anybody the first time you walk in the door to an ER either. So this is a really big step.
It is.
Okay. What's level 3?
Level 3 is where you start to get into some safety issues. So people might have suicidal thoughts with a plan. They might be having some verbal aggression, or they might be having some significant hallucinations or delusions. So you do want a police presence for that response for safety, and that is when the police are going to coordinate with the CSB or the local resources to co-respond a behavioral health clinician with a police officer.
And that's like the perfect combination because you have someone trained in the situation and you have someone trained to protect safety of both the person and everyone else in the room, but they're not necessarily banging down the door and, barging in a way that could escalate a crisis.
Yes. The police are there for safety reasons, and the behavioral health clinician takes the lead on the assessment and determination of what happens with the individual.
That is so cool. Okay, you said 4 levels though, right?
Yes. So the level 4 is when you have a suicide attempt or an assault in progress or a firearm present and accessible, and that requires a first responder response immediately.
Yeah, absolutely. Well, so that makes a lot of sense. Things that make a lot of sense don't always roll out the way they're supposed to. So the 911 we can publish, 988 we can publicize, but a lot of people or their families will call 911. So what happens if we call the wrong number?
This Marcus alert system is designed so there's no wrong door for crisis. So whether or not you call 988 or 911, both those call takers are going to be doing the 4-level triage. So if 988 receives a level 3 or a level 4, they're going to be transferring it to 911. If 911 receives a level 1 or 2, they'll transfer it to 988.
That's really cool. That's a lot of training, though. I mean, our emergency, our 911 operators are very skilled, but boy, they're skilled in a whole lot of things. That's a little bit of a new level to add in. Is there going to be training for folks on this, how to triage and what to look for and what to ask?
Yeah, the training so far has been in conjunction with the Regional Crisis Call Center. They've provided some training to the localities. Hampton has received that training, and they had their dispatchers trained and were able to start transferring calls on April 4th.
Wow. Because I remember when 988 rolled out, it was sort of this message to public information people that says, well, don't really publicize it because it might not be in your area yet. There's this implementation period. So when the federal pulled the trigger, it wasn't necessarily ready. So we're ready.
We are ready in Hampton, yes.
Now, you mentioned the term Marcus Alert. Mm-hmm. What does that mean?
So the Marcus Alert system is that system that Virginia created utilizing the 988 in the 4-level triage of behavioral health calls in Virginia.
So it's the state level of support for 988.
Yes.
And who is Marcus?
Marcus David Peters was a 24-year-old biology teacher who was killed during a behavioral health crisis by police. So the law that enacted this system was named in honor of him.
Wow. Wow, that tells us a lot. I think, one of the things we've learned during and after COVID is that a lot of people have mental health crisis. It might be big, it might not last long, but it has become a huge concern for so many people.
Yes, it is. And knowing where to turn for those resources is important. And 988 can be utilized not just when you're in a mental health crisis, but if you just don't know where the resources are in your community. Those regional crisis call center hubs are gathering the information about what's available in the local community so they can help guide people to the local resources.
Because in most cases, you're not going to solve a behavioral health crisis in one phone call. You're going to need something that is to follow up and to sustain.
Yes, definitely.
And that really can be fairly hard to access sometimes. So having some place that you can work through that with to be treated is really important.
Yes, correct.
So it's wrapping together a lot of services and initiatives to provide that, longer term solution.
Yes, definitely. And the regional crisis call center hubs also do have something. They have what's called care navigators to help the people who call 988 and are connected to help make sure that they can get to the care that they need for ongoing support.
And that's really, it takes a lot usually for someone to make that first call. And then they wake up a day or two later and they're like, oh, well, I'm not quite that bad. I don't, need to do this other stuff. And then it'll just escalate. So if somebody is kind of touching base and making sure things are going better, that's a wonderful thing. Mm-hmm. Is there anything I haven't asked you that you want to say?
I would just say, make sure you have the 988 number and that you can call it for you, your family members. If even, you don't have to be the one in crisis, you can know someone who's in crisis.
Right.
And 988 can provide you some guidance on what steps you can take.
Yeah, because a lot of times family and friends know they're a problem, but they have no idea what to do. And I think it's been called the suicide hotline for so long that I think most people don't think, well, it can be something less than I'm ready to commit suicide. It can be, all levels of behavioral health.
Correct. Any type of behavioral health crisis. It could be a crisis that involves anxiety and panic attacks.
Oh, yeah, absolutely. All right. Well, thank you so much for coming and explaining this. And I think the message we want to get across to people is call 988 if you are in trouble, if you know of someone that's having a behavioral health crisis, that it doesn't have to mean you are ready to kill yourself right now. Let's get to people before they get to that point.
Yes, definitely.
Okay. Well, thank you so much.
Thank you.
And I hope you have learned a lot about a relatively new resource that's available here that can help people at whatever level of crisis they are. Thanks for watching.